Dr. Wegner, when it comes to excuses why people don't come into the dentist, I'm sure you guys have heard everything, and I'm sure some of them are funny, except for the fact that it's not really funny, is it? Because people are kind of being detrimental to their own health.
Yeah, they can be. And you know, we do hear some excuses, and to be honest,
the main one?
I don't have time, the money. One that's a legitimate one is we see a lot of mothers and fathers who have put their kids first. And at some point, that's going to come back to them where they're going to need some work. And there's never, we always tell our patients there's never a bad time to start. If we can start taking care of them and fixing the issues now, that's better than later. It's always better now than later, because problems always get bigger. And sometimes, you know, people's priorities are just different at the time. I mean, my priority changed for a snowblower this winter. That was jumped up to the number one priority. So, so sometimes pain is a motivating factor, and that changes our priorities. So, but really, if we could encourage our patients to take care of the small things, do the regular things, so we avoid the pain priority, and we can take care of things that are small issues, small, relatively inexpensive issues before they turn into larger, painful, and more expensive solutions.
Right. And of course, we always think of root canals. What people don't necessarily know about root canals, if they haven't had one, it's not actually the root canal procedure that's the nightmare. It is the excruciating pain that you're in beforehand. I mean, when you actually have the procedure, it's like, oh, thank you. You know, it's a relief.
Yeah, I think we subconsciously tie together the experience we had with the toothache to the root canal procedure. But really, a root canal procedure it's just a longer filling. It just takes longer, but that's what gets us out of the pain. So it's actually that's actually the medicine. So.
And it is also the last resort, though, isn't it? Because if we're taking care of the little things along the way, hopefully we're not, which I clearly didn't when I needed mine, you're not going to need this huge, big procedure.
Yeah, I mean, hopefully that's the idea, right? That we can catch small things before they turn into big things. We can monitor things, and likely we can prevent root canal issues.
Right.
Yeah.
What other things can go wrong when people are busy making excuses and not coming in?
We can have gum issues. A lot of times we see people who haven't had a regular cleaning, and then we can end up with gum issues, periodontal issues that then become kind of challenging to take care of. It's not like we haven't seen you for 10 years and you come in and we can just kind of clean your teeth and start over. Sometimes there's damage that's been done that we're going to have to work on to get it all better.
So basically, although we all have excuses, I don't have time, I don't have the money, my insurance doesn't cover it and all that kind of thing, ultimately, you're making an investment in yourself. And that investment is that we're all going to eat, and unless you want to do so with an empty mouth and no teeth in there, the optimum thing here is to let's take care of the little things along the way, so when we get older, we're not going to have these massive issues.
Exactly. And like I said, we tell our patients all the time, it's not too late to start. We don't judge anybody. We're here to kind of help. I mean, that's what I feel like my job is help you whenever I can, do what we need to do to get you back to where you want to be. And you're right, it's an investment in something that we sometimes overlook, but our smile is the first thing people see. We need our teeth to speak. We need our teeth to chew. Basic things that we need, and sometimes we overlook those. But really, if we put that value and that emphasis on those things, we can save ourselves headaches down the road.
Yeah, so I think it's a matter of prioritizing, isn't it? There are going to be times when, we have to go and get a snowblower or something big like that comes up. But along the way, maybe we should be saving a few pennies in the bank to come and see you and take care of these things that are so important.
That's right. And so, like I said, we're here ready to help you when those priorities kind of align with what we feel like would be a good priority for you. But our job is just to help you.
So when you do need that help, think about, are my teeth going to fall out somewhere down the road? That's not what we want. So think about coming in here and seeing Dr. Wegner and the other staff here at Aspen Dental. Tell us where you are, Dr. Wegner.
Our office is at 1451 North, 200 East, just north of the mall.
It's a good time to get your teeth checked. Come on down. Thanks, Dr. Wegner.